Welcome to Hazy Too Clear TV from Buffalo, New York. I'm Josh Veronica. I'm joined today by Bradley Schober, Yasir Solomon, David O'Sullivan, and Andrew LaMartina. This episode's issue is the Affordable Care Act. The three of us heard Eric Cantor speak last week at Damon College and talk about the House Republicans' desire to change the Affordable Care Act. Yasir, what problems does the Republican Party have with the Affordable Care Act?
Well, our problem is it's bad for America. The law is inherently flawed. It's a failure. We've seen the train wreck that came out. And the problem with this law is, well, number one, let's just look at the numbers. Premiums have soared. Millions have been laid off their plan. And the employer mandate hasn't even kicked in, which is the majority of health insurance plan. When that kicks in, I mean, God help us. But just from how the law is inherently flawed, number one, employers are really starting to lay off workers, trying to, they can't really, pay for the health insurance. We're looking at employers laying off full-time workers and going to more part-time workers. So it's really, with all the extra taxes, I mean, our business is already working on a margin with all the extra, it's really harming the economy. And this time, we can't have something that harms the economy. The other thing is, this law is dependent on millennials, and these, how do you pronounce that? Millennials? Okay. Well, this law is based on millennials, which is young, healthy, single Americans. The problem is these guys aren't really signing up because, they've seen the train wreck. They don't need health insurance, and they're not going to pay for something they don't need. So what's going to happen is these young millennials...
I mean, everyone needs health insurance.
You don't need health insurance if you're a young, healthy, 25-year-old man.
So you're saying, if you were 25, you wouldn't need health insurance?
I wouldn't need health insurance. I don't need health insurance right now. I barely go to the doctor. Just a checkup, a physics, so I can go to gym class every now and then.
Say you get in an accident.
Let's look at the facts. The young millennials aren't signing up. And if you get into an accident, the hospital's not going to ask you for your insurance. They are required by law to cover you. And then they send you a massive medical bill. But let's not look at the ifs. I'm saying young millennials aren't signing up, which is going to lead to a massive bailout for the insurance company. Obamacare is dependent on people who don't need health insurance to basically buy health insurance, and then they're going to cover the people who were uninsured. Well, the problem is young millennials aren't signing up, which is going to lead the insurance companies to fail, which is going to lead to another massive bailout, which is not what this country needs. We're going after bailout, corporate welfare. Obamacare is inherently flawed, as we can see. It doesn't work. And you're telling someone who doesn't want to eat broccoli, buy broccoli.
Now, Brad, we heard Eric Cantor talk about how committed the Republicans are to finding an alternative to health care reform. What solutions do you see?
Well, first of all, I believe they need to bring someone in who actually knows how to make a website. Because
$1.5 billion spent on that website doesn't even work.
Yeah, that's probably.
This is about the actual act. This isn't about the website. So you can bring that up.
It doesn't matter how good the act is. If people can't go to the website and sign up, you could have the best act in the world. You could have the best healthcare policy ever. People can't sign up for it. It doesn't matter. But on the actual act, there are some parts of the Affordable Care Act that we could keep. For example, allowing kids to stay on their parents' plans up until the age of 26. That could allow younger people coming out of college so they don't have to go out and buy their own plans if their parents can afford and are willing to.
Maybe that's why the young millennials aren't signing up, because they're on their parents'
Well,
healthcare.
There's one problem. Not why they're not signing up. They're not signing up because they don't want it. They're not going to go ahead and spend $3,000 on something that they will never use.
Well,
just out of good
that
heart.
argument is flawed. You're going to need health insurance no matter.
Well, there's
what.
another major.
I know there are a lot of 25-year-olds
if it's
who are getting
flawed,
car
look
accidents
at the
and going to the
numbers.
hospital.
Millennials aren't signing up.
You
If
see,
it's flawed, I should be wrong. But the numbers
there's
are
another
flawed,
major
sir.
flaw within Obamacare. It is that its goal is to bring people who cannot afford health care.
That's a bad thing?
Wait, no, I'm saying that there's a flaw. The goal of the Affordable Care Act is to take people who cannot afford health care and to make it affordable to them.
Exactly.
However, it counteracts that by expanding Medicare. By
Premiums
doing
soar.
that, you have all the people who the act is aiming at. They no longer need to go out and buy health care because they can get it for free from the government. Then, all the people who are really signing up for the Affordable Care Act, they are the people who are losing their health care because of these mandates that have to be in their policy. For example, as a male, 27-year-old male, he needs to go out and he needs to buy maternity coverage. I'm pretty sure he doesn't need to worry about getting pregnant. Now, I could be wrong, but
You're not wrong, Joe.
that's what I'm just feeling.
Now, that's a Republican perspective. Andrew, what is the Democratic perspective on the rollout of Obamacare?
Now, I mean, personally, I believe that, I mean, no one can argue that Obamacare is flawless. It's being reformed, and we're attempting to get it as perfect as possible. But
At the
it still
expense
has
of the American people.
it still has a little ways to go, although it is ultimately good for the country. Because it provides, I mean, as the name suggests, Affordable Care Act, it provides affordable health care.
It doesn't. Premiums have soared. You can't
to
argue with the
those who
numbers.
need it.
You
So-
can't argue with the numbers. Premiums have soared.
Also,
No,
the
the
CBO, I
the
believe,
goal is to keep it
reported
below,
that people-
to keep your spending on healthcare below 15% of your income. And I mean, so obviously that number changes, like depending on how much income you take in per year. And in regards to businesses, which I know you guys are talking about, when it comes to small businesses, the businesses will actually receive subsidies if they need help paying for this affordable health care to be available. However, with the larger businesses, where they're more well-established, they're not going to be as affected by the Affordable Care Act.
They are.
But
They are working on a
then-
margin. You don't know how many. You don't know how
Let-
bad
let
the
me just say
economy
though,
is,
then-
Andrew. These
but-
businesses are being affected,
No,
and they're
we
going
do-
to.
we
We
do
know how
Smaller
bad the economy is.
businesses.
That's why we need Obamacare.
No,
The smaller
Obamacare hurts the
smaller
economy. Don't
businesses
try
that
to
are
spin
going
this.
to be affected
Obamacare is
most by
horrible
it.
for the economy. You don't know how many businessmen came out and spoke out against us. You could already see.
Sir,
People
oh
just
my-
want to
sir, let
spend
me
more
tell
money
you-
for their.
The smaller businesses that are going to be affected the most by Obamacare are receiving these subsidies. However, the larger businesses that are more well
They're
established,
laying off workers. This is
No,
hurting the
that's up to
workers.
the
This is
employers
hurting
to
people
either
that are
get wages
poor.
from the
laying
The
employees
people,
at the top
the people who are
and
being
giving
laid
back
off
to
are
the-
low income. This is hurting the poor. It is hurting businesses. It is hurting the economy.
How is it hurting the poor?
Because these people who are being laid off, who do you think these people are that are being laid off?
Ultimately, it's up to the
people-
business to decide where they're going to cut
Well, when you
spending,
tell the
whether it be raise
business,
cost
if you
of
have
product
51
or
employers, if
it
you
would
have
be
51
cut the-
employees,
cut the
you're going to pay for all of your
wages of the
insurance.
people at the
You're
top
not
and
going
then put that back into the healthcare
like
for it to be more
we've
affordable.
seen the results, CBO reports, and we have seen it in real life. You know, businesses are actually laying off workers. You don't know how many workers that I know that have been moved down to part-time or have been laid off because their employer
Ultimately,
doesn't
that-
want to
that
pay
part
for
is-
their insurance.
Doesn't
It's hurting
want
the
to pay
economy.
for it. They do have the option to pay for it.
They
They
do,
can
they
cut spending
must
from
pay
other
for it.
things. They don't have to lay off the people.
Well,
They are,
what do you mean?
because
So
they
you
wanna
want to
make
cut? So
money.
it still hurt the economy. So you want to cut it off at innovation? Where do you want to cut it off?
No, from these people that
From
are
their-
all the way at the top that are making insane amounts of money for their income. You can cut their raises.
It doesn't
So
matter.
you're trying to tell a business now how to run their business.
Yeah.
You
No,
can't
we're not
just
telling
say
businessmen
how
not
to
to be
run
so
their
greedy.
business.
So
I'm
it's-
just saying that they should be able
you are
to
coming
healthcare
in-
for the people that can't afford it.
Premiums have soared. Millions have been laid off their health insurance. The businesses are being hurt, and now you're trying to spin this. There is nothing good that came out of Obamacare except a
It's
few
good that
things,
comes out.
such as people with pre-existing conditions can get coverage. That is one
That's
of the
not
few
good. So you're saying that's not good. Like,
that is one of the few
Then
good things of
say
the
it.
Affordable
What do
Care
you
Act.
believe- what
That
do
is
you
one
believe
of
should
the, other
happen
than that, the
if
Affordable
Obamacare
Care
were canceled?
fails in every single aspect. Does not provide cheaper insurance.
And you just said
does not
that
provide
it
insurance for the
It provides
uninsured.
insurance for
Uninsured people aren't even signing up.
Now we're out of time for today. Thank you for watching Hazy 2 Clear TV.